Sammy has glycogen storage disease type 9. GSD is a hereditary genetic disorder of the liver. Sammy can take glycogen or sugar in his body, absorb it, and store it in his liver, but he can't take it out. Can't release that as energy. It's like hyperglycemia, which is low blood sugar, all the time for Sammy. As soon as he's out of blood sugar, he starts burning muscle, preventing growth, preventing brain function, and stopping all the normal function of a 5-year-old boy. To keep this damage from going on, we have to supplement his blood sugar. Sammy uses cornstarch and artificially prop him up to normal levels. We give it to him 5 to 6 times a day, and that's all him drinking it physically. A lot of the kids have feeding tubes, and we don't do that because Sammy will take the cornstarch. He fights, but he'll eventually take it. We have to chase him around, and he's a runner. This disease was fatal until 1974. So until then, the kids just died. The older kids get the shaft of it. Sammy gets sick. We drop the older kids, the grandparents or the aunts and uncles, while we go to the hospital with Sammy. My wife and I take 12-hour shifts in the hospital, and we have to monitor the hospital staff completely because it's not a familiar enough disease that anybody can do anything. Any schedule we have to have his food with us. So if we go to the movie theaters, we have to take his emergency bag with him and have his snacks in there. So he's limited to 5 grams of sugar an hour to be able to not damage his liver. You know, CJ and Maggie will have ice cream, and then Sammy will have like sugar-free ice cream. Before we were diagnosed, we were in the hospital every 2 weeks for probably 3 months, and it just was getting worse and worse. He was diagnosed as autistic during that time, and he had no brain function of memory because every time he'd go into these low blood sugars, it would wipe it out. So he had to relearn to walk at 3. He had to relearn to talk. He would talk, and then he'd get sick, and he would unlearn it. It would just wipe his brain. So they diagnosed him as autistic, but he didn't fit in the pattern. So we kept looking as what's wrong with him, and eventually found it. During that bad time at the hospital, they ended up life-flighting us, putting us in the helicopter, taking us to Miami Children's Hospital, where one of the doctors had been to a conference on GSD and started cornstarch therapy, and Sammy started to thrive. He knows these doctors so well that he, has them as heroes, but still a 5-year-old kid to have doctors as heroes is kind of heartbreaking. It's good, but it's sad too. Kids should want to be baseball players. It just not like a normal kid, so we don't know what's going to happen.